Welcome, everyone. We're going to begin shortly. While we're waiting, everyone put in the chat where you're logging in from. We like to look at that later. Today's meeting will be recorded. Okay, it's going to live live on the YouTube pages afterward. We are going to have human-generated captions. You can access those by clicking the CC button in the bottom of your toolbar. If you need ASL, please put an asterisk in front of your name so the interpreters can locate you quickly. And please feel free to put any questions in the chat box. We're hoping to get to as many as we can. Okay, we're going to go ahead and get started. My name is Kimberly Shea. I'm a founding member of the Global Alliance, and I am currently the treasurer. I own Breaking Barriers Captioning. I spent 14 years of my career as a court reporter, and both as a freelancer and official. And then I transitioned to captioning about 12 years ago. I've had 4 certifications, 3 in court reporting and 1 in captioning. I hope to have my second one in the near future. So I've been a stenographer for 26 years and an advocate pretty much since birth. I've been screaming for food and fairness ever since. I am joined by Michelle Michaels, Director on the Global Alliance Board. Michelle is a hearing healthcare program manager for the state of Arizona at the Arizona Commission for the Deaf and the Hard of Hearing. In her role, she manages the Hard of Hearing program with 2 team members. As a whole, provides assistance to over 1 million Arizonans with various hearing levels. Michelle is a national leader and passionate advocate for persons with hearing loss. She speaks frequently at conferences and advises colleagues on initiatives across the U.S. The Global Alliance of Speech-to-Text Captioning is an organization of captioners and industry professionals, in addition to consumers and advocates who rely on and support quality captioning. Our board consists of people that bring different perspectives, experiences, knowledge, and subject matter expertise to the table. Welcome, Michelle.
Great to be here with everyone.
Okay. Our learning objectives today. Why is accessibility important? Today's information is going to be a high-level conversation to generate It's going to be a high-level conversation to generate and spark a much-needed change in the way that the medical community communicates with their patients. We're going to ensure that your facility is providing patients with disabilities the proper, equal, and effective access. The purpose of that is to avoid errors and protect patient rights and achieve positive patient outcomes. The most important words are equal and effective, and there's times that you can only do that with accessibility accommodations. And that's why it's important to have an accessibility plan. Why do you need to provide accessibility? Accessibility supports patient-provider communications, which in turn ensures patients have a clear understanding of their condition, their treatment, the obstacles with treatment, what the goals are, and patient safety relies on this effective communication. There's a big difference between a patient leaving the office being unsure of what was said, unsure of what the goals are, and then leaving knowing what the plan is, understanding their condition, and feeling secure about that. Michelle is going to go over some stats with you.
Hi, okay, so thank you, Emily, for that. I am a founding founding member of the Global Alliance and a director on the board. I serve on the board as part of my job here at the State of Arizona Commission for the Deaf and the Hard of Hearing. And I am a private donor to the organization as well, because captioning is super, super important to me. I am hard of hearing. I have a bilateral progressive hearing loss. I do sign, but that is not my primary communication. My primary communication is spoken language, and I use assistive devices, captioning, my hearing aids, that kind of thing, to communicate better. So statistics is, and again, the Global Alliance is an international organization. And what we're doing is endeavoring to create a standard of quality captioning throughout the world. And so when you look at people with hearing loss, all levels of hearing loss, from profound deafness, people who might use a signed language in the United States and Canada, it's American Sign Language, other countries, it's other types of sign language, or hearing aids or whatever. We've got 360 million people worldwide who have a hearing loss. It's really the #1 disability in the world, in the country, and in this state. Over 70 million deaf people. And by 2050, the projections are clear. We're going to have 2.5 billion people who are going to have some degree of hearing loss. And that's either, infants that are being born with hearing loss for a variety of reasons. It's noise exposure, it's ototoxic medications, it's a lot of different medications. So 1 in 7 people, here in Arizona, 18%, so almost 1 in 5 people have a hearing loss. There are over 1 million hard of hearing people like me in the state. We have about 25,000 culturally deaf people in Arizona. And we also have several hundred deaf blind people. In the United States, about 1 million people use American Sign Language. Now, in this presentation, we're really talking about captioning. The Global Alliance is an organization about captioning, and deaf people do use captions. Deaf blind people use captions. So we're not going to focus a whole lot on American Sign Language, but that is not a population to be ignored either.
So these are a list of lived experiences that benefit from accommodations with captioning.
And this is not all inclusive, but
right.
Children, if you turn on the captions on your television for your little ones and your grandkids, they will start to learn that, whether it's English, Spanish, or whatever that caption is, they will start to learn language sooner. So captioning is really great for deaf, hard of hearing, deaf blind, people with combined vision and hearing loss, auditory processing disorder, which I've got a friend who has that. It's definitely an issue. ADHD, autism, Down syndrome, brain injury, limited English, English language learners, cognitive processing disorders. All of these folks can benefit by using caption, and captioners can modify their output to match the needs of that person. So, what you see today is pretty much standard, but again, that can be adjusted by these trained and certified professionals.
It greatly increases content retention as well. The studies have shown that. Okay, we're going to talk a little bit about risks. Michelle, we were talking about this the other day. There were specific numbers that you were telling us that are very difficult for people with hearing loss to hear.
Yeah, in the medical profession, you're using numbers a lot. You're saying 15 and 50. And I cannot make out the difference. I mean, I know them. I know that 1, 5 and 5, 0 are different. I know that they're different amounts, but I can't understand it. And that's, for hard of hearing people, making out numbers is really difficult. And then you're using technology or technical terms, lisinopril and levothyroxine and all of those kinds of words. And so people who don't use those words often will also not understand exactly what's being said. So, if a nurse is looking down at the clipboard and says, okay, you need to take 15 ounces of that every day, And I'm like, 50 ounces, wow, that's a lot, okay. And then I overdo it, right? And I come in the next day and I'm all bloated or I'm sick. So it's really super important that you're conveying the information correctly. And I am an advocate, obviously. So I will say, did you say 1.5 or 5.0? But 1330, 1440, 1550, 1660, it all sounds the same. Even though I have great hearing aids, the captions or writing things down, that's what's really going to help me. So we want to prevent medication errors. We want to encourage patient compliance with directions and instructions. And so communication is the most important thing. Other than, I mean, what is it? It's all about avoiding errors, right?
Right. Do no harm. Right.
So you want to avoid those kinds of mistakes by making sure that you're clearly communicating and watch for people's reactions.
Right.
Us hard of hearing people are really good at bluffing, but you might see, a furrowed brow or a little bit of a confused look or oh, okay. And we're not really clear. So pick up on that, respond to that nonverbal communication. Ask questions that are not yes, no. So, okay, what are you going to do tomorrow? When are you coming back for your appointment? So make the person repeat back to you.
Well, poor communication is one of the biggest risk because with that comes errors in, like you were saying, the medication, but it's not just with hearing loss too. It could be with people who speak English as a second language. It could be a multitude of reasons, and the main risk is patient harm, which that's the priority. You don't want to do that, but the end result is often litigation. That's kind of what things result in. And recently, Quest Diagnostics went through legal action because they were requesting blind people use that touchscreen kiosk. And I know that we live right now in a world of COVID and social distancing and lack of contact, but those things are very real. And I mean, I have those lived experiences as well. And when you are going into an office and you're having to deal with all of those things on top of trying to communicate, it's extremely stressful.
Yeah, if you can't see or hear, and of course everybody's wearing these still, I mean, medical professionals routinely wear masks. And so sound through a mask is greatly degraded.
Oh,
so
absolutely.
That really creates an issue as well.
Okay, so I'm going to talk a little bit about some of the laws that are outside the US, but Michelle is going to take the lead on the laws here with the ADA.
Okay, so here in the United States.
It's all you.
Okay, here in the United States, the laws that affect medical communication with patients, the ADA, the Americans with Disabilities Act, signed into law in 1990, and then the Amendments Act as well, which I think was 2010. And, the ADA, what it said about hard of hearing people was if you have hearing aids, you're okay. What we know is that 1 out of 4 people who need hearing aids get them. And even with hearing aids, our understanding is about 4 to 6 feet. So beyond that, they don't help as much unless we use other technology like a remote mic. So the Amendments Act said, even if you have hearing aids, you still have a disability. And so, and obviously people with cochlear implants, they have a hearing disability. So the ADA and the Amendments Act, they all require equal and effective communication. Section 504 of the Rehab Act of 73, that was really the first really big disability rights act that we had. And that applies to federal, anybody who receives federal funds. Also, Section 1557 of the Affordable Care Act, that says if you're providing services to patients and you're receiving federal funds, so if you're Medicaid, Medicare, VA, anything like that, you've got not just the ADA, but other sections of other laws. And it's really, when it comes to the hard of hearing, deaf, blind, it's about equal and effective communication. How effective is that communication? Are you providing the appropriate accommodations? Are you providing, written notes, written instructions in plain English or the plain language, plain Spanish, whatever it is? Are you, facing the person? It's a thing that I know Christy's on here with me, my hard of hearing specialist here. Christy and I are both hard of hearing, and we're always saying, look at me. Please don't look down at your laptop. Please don't walk down the hall facing away from me, because if you're asking me questions, so there's simple things you can do. Captioning is one of the things you can do, but there's other things, writing notes back and forth. Just make sure that's effective. And again, you want to ask those not yes, no questions, but context questions. What are you going to do? How are you going to do that? How many are you going to take? When are you coming back? What are we doing to you tomorrow? That kind of thing.
Okay, so when we were pulling these, this process together, we have members that are located in Canada. We have colleagues in London, and another one of our directors is in Poland. And one of the consistent things that they said was that while they do have some laws and regulations, nothing has the teeth that the ADA has. So in the UK, they have the Disability Discrimination Act of 1995 and the Equality Act 2010. And most of these provide for people to have sign language interpreting or induction loops, but some of them, they don't require captioning. There is the Accessible Information Standard that was issued in August of 2016. So that affects anything that's the National Health Service, which is the publicly funded healthcare, which is most of Europe. It's the majority. So they they are required to provide speech to text reporting for patients who ask for it. But again, they all said the same thing, that it still doesn't have the teeth that the ADA has. And there are people advocating every day for progress. Canada was similar. They have 3 provinces, Nova Scotia, Ontario, and Manitoba, that have accessibility legislation. But again, it was the same thing, that it's not the same as the ADA. Okay, Michelle, section 1557.
Yeah, so here's even more information. So we'll stay on this slide. So all of you who are watching live or watching the recording, as you come into this, you can kind of take a look at this and look at this language. But stricter requirements, Title II, the accessibility, and again, that primary consideration. So if I say, hi, I'm coming for a consult on my surgery and I need CART captioning, that's what I need to get. Don't open up your laptop and run automatic speech recognition, speech to text. If I ask for CART captioning, then under the ADA, that's what I need to get under Title II. Automatic speech recognition, the speech to text apps, and there are dozens of them. Google Live Transcribe, all those different ones might be okay in some situations, but if the patient requests something, or and this extends not just to the patient in the United States, but to their partner, their family member. So if their husband or wife is the one with hearing loss and they're their patient advocate, they're in there with them, that effective communication also applies to them. So again, any organization receiving federal funds, and most healthcare facilities do, you want to be posting things, want to post notices at your emergency department, on the front door of your facility that says, we provide effective communication, who's here to contact, how to get that set up. Make sure that your frontline staff know, when like I refer to my teammate Christy, when she calls the hospital and asks for CART captioning, she shows up and she has an American Sign Language interpreter. Christy doesn't know sign language. So make sure your staff know the difference between the different types of accommodations. It was in the United States, when it comes to sign language, that interpreter has to be qualified. So the translator, if you're translating from one spoken language to another, they've got to be qualified. In the United States, RID is the organization that actually certifies sign language interpreters. So again, you want to make sure you've got quality people, not just a signer. Oh, we have a staff member who knows some sign language because their mom was deaf. That's not going to be equal and effective communication. So you don't rely on staff. Don't ask the child of a deaf adult to sign for you. Don't ask the wife of a hard of hearing man to re-speak everything that you're saying into their good right ear. Don't do that. Don't put that burden on the family. Accept that as your responsibility as a facility, and have a process. Make sure you have contracts with captioners, with sign language interpreters, with translators, whether you're using Language Line. Make sure you have contracts set up well in advance so that you can get a hold of those folks when needed.
I was surprised to find out when speaking to different facilities that some of the staff really thought that it was the patient's responsibility to bring in their own cart or their own interpreters, or their children or their friend who came in to interpret. So I thought that was interesting. I shared the document with them.
Over 30 years since the ADA, and we're still we're still told to do that. Okay, well, sure, you can bring that person with you. And we get calls at our state agency on a regular basis from usually it's smaller practices saying, gosh, I've got a deaf person coming in. How can you guys give me an interpreter? And so we walk them through that process of how to do that. The same thing with CART. And if you're a state organization, a CART, captioners, communication access real-time translation, might be under interpreters. So they might be under that heading if you're looking for folks who provide that service.
Okay. We have a demo.
Welcome to the Global Alliance's Caption Provider Demo. Did you know caption providers use different techniques to do their jobs? These captioning techniques are called methods. Let's look at two of these methods. One method is the use of a steno machine. These captioners are called steno writers. Another method is using a microphone and a voice recognition software. These captioners are called voice writers. All captioners use software called Computer Aided Transcript Software, or CAT. This software aids captioners to provide a near-perfect transcript for the consumer to use and engage in events that are happening in their day-to-day lives. For example, doctor visits and exams, classroom lectures, and seminars. This CAT software is transmitted and viewable using platforms like StreamText, making working with consumers seamless and confidential. As you can see, both methods of captioning provide quality captioning services for consumers. Global Alliance offers this demo to give you a glimpse into captioning. Visit speech-to-text-captioning.org for membership and upcoming educational videos. Our vision is universal accessibility to the spoken word via all forms of captioning. Well,
Okay, so this is an example of what the view looks like on, for instance, a tablet or an iPad, any kind of device in the office that the patient has control of, that holds and looks at themselves and doesn't have to have someone translating for them. So one of the most important things about providing accessibility, ask the patient. Always ask the patient first, because they're going to know exactly what they need to communicate, and they can express that to you. And if they tell you, as Michelle said, if they tell you what they need, don't assume that something else is good enough.
And I would just add that deaf folks who are born deaf, raised deaf, gone to deaf schools, they've had American Sign Language interpreters or sign language interpreters in other countries, so they know, hey, I need an interpreter. Hard of hearing people, and again, 48 million people in the United States are hard of hearing, over 1 million here in Arizona. Hard of hearing people they're not all like me. I'm going to tell you what I need. I know what my function is with my hearing aids and things, but when you're doing an assessment of that patient, you want to say, what is your primary language? What do you need to communicate? Ask those questions up front. And then if the person says, well, I'm hard of hearing, and you ask, okay, what can we do to communicate with you better? They might say, well, my wife makes sure that she's in the same room with me and she looks at me. Okay, awesome. That may be all that you need for that person, but it depends on the environment. So if you've got a big group of the public coming to an educational session about some new initiative that you have, you've got to assume that 1 out of 6 or so people there are going to be hard of hearing. You may have some deaf folks, so you might be needing to set up some accommodations in advance, just expecting that you're going to have folks. But hard of hearing people don't always know. So you again, first meeting, you might assess them and realize they're asking, what? Can you say that again? Can you write that down? That's an indication that that person really needs captioning.
So another important thing is that this actually happened to me. So I'm going to tell you a little story. I went in for an outpatient procedure last month. And when that happens, there's a lot of things that can cause you to be nervous. And I was. So I go in, and it was a situation where someone, had to drive you and that kind of thing. So I was very nervous about it. But I'm filling out my paperwork, and this appointment had been scheduled for about 6 weeks. And so she hands me all of this paperwork, and then she says, I need you to sign this. Do you need any accommodations? And she hands me this paper with a lot of words on it. And I looked at it and I thought, okay, well, this is great, because a lot of facilities do want to be accessible, and they say, they pride themselves on their accessibility options. But on the day of, I looked at it and I said, this is really wonderful that you're offering these accommodations. Can I get a captioner today? And she said, oh, I don't know. I'll have to check. And I said, okay, knowing that I am a captioner. And I thought, unless you have one on staff, you're going to be real hard pressed to find an interpreter, a language interpreter, an ASL interpreter, or a captioner on that same day. And so she came back and she said, we may have to reschedule. And I said, well, that's okay. And so then I shared with her about the process, and, we had a nice little chat, and she was great. But those things are wonderful, but they are not going to help you the day of. That is something that needs to be done at the time of scheduling. And also taking accessibility training and learning what accommodations and assistive technology are out there that help people, and know which ones benefit different lived experiences. And then you're able to form these relationships with the different companies that provide these services. A lot of people want to go to the one-stop shop. I need this, this, and this. But what most people don't always understand is that sign language is very different than captioning, and the same thing with language interpreting. They're very niche professions, and one may not know what the other needs for prep material or connection material, setup equipment, anything like that. So understand those things, and then form relationships with different businesses. And then there are different ways to get the services that you need. We want to talk about HIPAA a little bit, because that's something that most people, that's the first thing they come back with. What about HIPAA? What about HIPAA? And there are different ways. So for instance, with the streaming, and there's a demo that link that they're going to put in chat, and you can see how the live text feeds through. That's a streaming platform. I have a dog. My apologies. And so the streaming platforms have password protected logins that you can do. And then there's other ways that captioners can share their screen virtually. And so it doesn't even go through a server. NDAs with the service provider are always a good idea. Mandatory file deletion is something that I put in contracts so that to protect everybody. Avoiding using names is always another option. Michelle, do you want to add anything?
Sure, yeah.
I'm going to mute myself for a moment.
Pet your dog. Pet your
We're
dog.
working at home now, guys. I don't know.
Yeah, let's see. Oh gosh, there's so much here. HIPAA. Yeah, we get that question here in the United States. We have HIPAA, patient privacy protection, and I always say there is no person who wants to walk up to the counter at the pharmacy and ask for their medication, and they come back and they say, yeah, this is for your hemorrhoids. And you're like, what? And they're like, this is for your hemorrhoids. And everybody's looking at you and you're like, what did you say? Because your doctor called it in. I mean, nobody wants that, right? So we want to protect patients' privacy. So you need to know that sign language interpreters in the United States, CART captioners, typewell, CPrint, voice detect, whatever type of captioning it is, that is totally confidential. These folks are trained professionals in one ear and out the other. No, nothing is saved, nothing is conveyed. So there's strict federal and state, in some states, state laws regarding that. So if someone is contacting you through a caption phone or a video relay service, that is all completely 100% confidential. You don't have to worry about having a conversation with a patient over those types of devices. So just don't worry about that. This has been around for a long time, and it's all set up so it's completely private and no worries there. So, but yeah, captioning is an awesome way to convey information to a person without telling the whole waiting, all the people in the lobby what you're talking about.
Okay. Well, the last thing that I'll say, hopefully really quickly, nope, didn't make it. My apologies. So 4 to 6 weeks is really a good time frame as far as notice to these agencies that are going to need to provide you services. But the part about developing an accessibility plan beforehand, that falls into the description of universal design. And that's something that is providing access beforehand so that people aren't even forced to disclose their disabilities. It's making an inclusive environment from the beginning in the planning process so that everyone feels included. And the next thing is questions. So
Yeah, and one of the things, Kimberly, that we get asked a lot is, well, why do we have to pay for this? And what I really help folks to understand is, in your facility, if you're renting or you're owning, you've got wider doorways. So just imagine that you own your own freestanding clinic. When you built that, you bought more land because you need more space for your doorways because they have to be wide enough for wheelchairs to get through. So you actually bought more land. So you paid for wheelchair access. You've got your wheelchair handicap accessible parking. You've got your curb cuts and the braille dots, and things like that. This is all in the built environment. You've paid for that, whether you're paying rent or whatever. You're paying for that or have paid for the built environment. So it's accessible to people with physical disabilities. Effective communication is on the spot kind of thing. You also have to pay for that. And so some insurance companies will cover that as an accommodation. But that's something that's on you, because again, you're paying for all access for all kinds of other folks. So it's not fair to ask that person to pay for their own accommodation so that they can access your programs and services.
Okay, so we do have time for questions. Hopefully that's not because I spoke too quickly.
Well, I've actually had a question that was sent to me, and it was about how do hard of hearing people self-advocate and educate doctors, because it seems like a lot of medical providers are unaware of captioning, and that is true. There's, here in the United States, we have the Hearing Loss Association of America, we have the Association of Late Deafened Adults, we have the Say What Club, we have lots of little groups, like in Southern Tucson, we have a group called the Association of Late Deafened Adults, or Aloha Associate, well, whatever it is. And so that you've got, chapters and groups and websites. Our state website, we have lists of accommodations, we have CART brochures on there. So we have a lot of information accessible to hard of hearing people. And so we really recommend get yourself educated so that you can educate the provider. Tell the provider, you know how deaf people all use sign language interpreters? Well, I'm hard of hearing and I use speech to text captioning. And they're, oh, it's like it's the same thing. Okay, got it. Or have you ever turned on captions on your TV? Well, I need captions when I'm there in the office with you. So make it something they understand. So hard of hearing people can do that. There's also an association of medical professionals with hearing loss here in the United States. So that's a great resource.
Great. Okay, so I don't see any, I see some comments which have been addressed already. So I do want to take a minute to thank our captioner,
like-
Kelly Ward.
Here,
Oh, wait.
Jenna has her hand up on here. You see? Hey,
Oh, I
Jenna.
can't see.
Yeah.
Got it.
Yeah, hi, can you hear me?
Yeah.
Yes.
Yeah, this is Jenna Curtis from OHSU, Oregon Health and Science University. And I just had a question. One of the things that we're really struggling with our captioning program currently is that just the transition from in-person captioners to remote captioning with the COVID-19 pandemic. And one of the things that we've seen and really struggled with is being able to provide the right equipment at the right time, because we used to have on-site captioners who would show up with all the equipment, they do the education, they would basically provide more service than just the captioning. They do the education of the professionals, they'd come in, connect with the patient, move the equipment around as needed if the patient was going to a MRI or has labs or something like that as needed. And now we just are struggling with many of our captioners in our area just are only providing on remote captioning services. And I just wanted to hear your thoughts on kind of where the profession's going on that, and any advice you have in terms of, obviously it's just a huge barrier to get the equipment and do the education. Our providers are not sure how they connect. We send them emails and tell them, hey, you got to jump onto this Zoom meeting or this WebEx meeting with the interpreter or with the captioner. And it's just kind of been a real challenge and a real barrier for people who we are really trying to provide captioning for.
So yes, COVID has presented a lot of those issues. Are you saying, when you say the equipment, the captioner would bring the equipment in, what equipment are you speaking of? Are you speaking of the tablets and the things that the patients have? What are you speaking of exactly? And all captioners should be giving that education, or firms should be giving that education to the clients. So.
Right. Yeah. They bring in the steno machine, for the CART machine, and they would have the screen that would be viewable to the patient. So they'd bring everything in. And now we on our end are needing to communicate with providers to show them how to log on to a virtual meeting, to get them connect with the captioner at the right time. So it's a much different experience, and we've had a lot of barriers with it.
Okay. I see. Yes, I think we've all had those same barriers. I think that captioners, as far as where it's going, captioners are starting to go back on site now. Tell me again where you're from. where you're at, Oregon.
We're in,
No,
yeah, we're in Portland, Oregon.
Portland. Okay. I think that connecting and doing all those things is a struggle for everyone. I don't know that we're ever going to completely get past that until we all go back on site again. But are the captioners, I guess I'm wondering how they're giving instructions to you. I mean, I'm kind of concerned because they should all be educating you on how to give these instructions.
And I think Jen also has a comment. Jen is
Jen is our chair.
online.
I can just speak to my experience, Jenna, that in providing services to a doctor's office that is not in my locale, they're far away, and there is no captioner in their vicinity. And we've been using their telehealth platform, even though the patient is on site and the doctor is on site. It's as if you know, it was back in the day when nobody was on site, and they have an iPad and they pull up the platform like we showed the demo for the patient to be able to see the captions. And then I am participating via telehealth essentially. And they carry the iPad with them around the offices, or to any locations that they need services. So that's the way we've been able to handle that. Granted, that relies on technology and good internet bandwidth and good microphone and the ability for me to be able to hear well. But if I don't hear well, I actually do speak up and ask for clarification or to make sure that I have the correct spelling of the medications and anything that I'm not 100% sure of.
Thank you. That's helpful.
Is it helpful? Thank you, Jen.
Yeah, thanks, Jenna. And OHSU is awesome. I visit your website. It's just done so many great things in collaboration with other organizations. A lot of great hearing loss information. So, and when I visit my friends in Portland, I always think I've got to drop by and see you all.
Well, we'd love to have you.
Michelle Linder has a question.
Hi, everybody. I'm going to touch on the same subject. Living in a location where there are no court providers in the area. I live up above Duluth, Minnesota, and court providers have to come up from the cities, which is about 3 hours away. And so I've shown up for doctor's appointments and actually test at the hospital to find a sign language interpreter waiting for me. And I've not even requested anything, but I've used captioning in the area for political conventions where I've served as a delegate. And so I know there is no one there. I've called all of the colleges, everybody, all of the court reporters. No one does CART in Duluth or the Duluth Superior area. And so that's a real problem. And I don't know, I'm a captioning advocate, and I just don't know how we can get court providers more dispersed and more available to those of us who live in more remote areas. And I'm a very good communicator for myself, and I don't leave a doctor's office until I know exactly the information they are giving me, and I have doctors who are very good at that. But I'm just wondering how we can advocate with hospitals. There are several hospitals in the Duluth Superior area to maybe employ a court provider, or I'm sure they, there are sign language interpreters in Duluth, but no CART providers. And I'm just wondering how to go about advocating with the hospitals to possibly maybe share a CART provider. I don't know.
Education and awareness. I mean, it's going to take education and awareness on a large scale. one day at a time. I mean, a lot of companies are starting to put CART providers on staff for those reasons.
Yeah, and it makes sense to do that. You know, traditionally, it was CART, communication access real-time translation, came up through court reporting schools. But, you know, now that we've got, you know, voice to text and lots of different kinds of, you know, voice captioning, seat print, typo, et cetera, you know, we really do need to encourage that, you know, we get more folks trained in this field. That hearing loss is not going away. I wish it did, although I like having a job, but it's not going away. It's increasing. Hearing loss is increasing. 3 out of 1,000 babies in the United States is born with hearing loss. That doubles by the age of 6. By the time, you know, folks are in you know, their 50s and stuff, a third to a half have hearing loss. So it's not going anywhere. So we need to get this communication access set up, you know, worldwide. And so it's a great field to be in. Our CART providers here in Arizona, when we get to see them in person, we make sure that we bring them water and cookies and snacks and things. We love them. They know we love them. We're so appreciative of the work that they do for us. And so hopefully we'll get more and more of these folks throughout the country. Again, you're providing access for people with disabilities, and it's just a wonderful career.
I was going to say on the next slide, which has, you know, the website information and things like that, but I was going to say that the Global Alliance, that's one of the reasons that we formed the organization, because there was such a lack of awareness and education about captioning itself, where it was useful, who it benefited. And, you know, we needed something that brought together the service providers and the consumers to communicate together to find out what services are best, what work. There's also a lack of quality. You can't just check a box and, you know, call the cheapest place and check a box and say, okay, this is done. Quality matters. And the Global Alliance is focused on quality captionings quality captioning by every method. So as long as it's access and it's equal and it's effective and it's quality, then that's something that we support, because there are so many different avenues that patients use for communication, and they should all be high quality.
So for the medical professionals watching this, if you're in the United States, look and see if your state has an organization like mine. I think 36, 38 states do have a commission or division or department for the deaf and the hard of hearing. And so you can reach out to them. We do here in Arizona, we do healthcare trainings a couple times a month to hospitals, nurses, clinics, et cetera. And then we train on the full spectrum. So we train on how to communicate with deaf, blind, hard of hearing, and combined vision and hearing loss. So the whole population that you're serving who needs equal and effective communication. And those trainings are free. So, you know, reach out to your local organization, your state organization, and ask for that training. And that can also be really, really helpful.
And the Global Alliance also has a lot of resources on their website. So we'll help in any way that we can as well. Can I thank our captioner interpreters now? Kelly Ward is our captioner. Thank you so much for your time. And Rose and Jessica from Komen Certified Interpreting, thank you for being here. And if you have any other questions, here is the websites. Please engage with us on social media. Our website is here. The videos, we do Empower Hours, hopefully once a month. It's been 4 to 5 weeks, different topics all the time. Those will be on our YouTube channel. And email us with any questions. We're very responsive.
Yeah, I'm so glad that everyone came today, and I hope that more folks will share the video once it's up. And of course, you're going to be able to see the sign language interpreters. You're going to have accurate captioning. So I hope more people will be able to see the video, share the video. We want to raise awareness of the need for quality captioning throughout the world for people with hearing loss.
Thank you. Thank you, Michelle.
You're very welcome.
Check